This is our good friend, Dr. Diane Madfes. She's a board certified dermatologist in everything face, skin, facial rejuvenation, lasers, as we were talking about, fillers, general skincare, skin cancers. Dr. Madfes, in fact, helped create some of your favorite products for L'Oreal's Garnier skincare. They're out there and they were hers and they're amazing, as well as her own burn cream, which I have and still use.
That's good.
Yeah, no, of course. So interesting. But that's the thing about your, not just your industry, but you specifically are always doing whatever the cutting edge technology is. So how do you learn about it? Like, are there seminars? Do you read? Does people show up and go, here's the software? Like, how do you know?
Well, I read, and we have wonderful societies, our Derm Society, there's local and there's international, and then we have our journals. And so every day I spend about an hour studying, reading, whatever. And then our conferences, which were curtailed for a little bit, but my colleagues and all the research, a lot of it we're able to do virtual. So there's webinars every day. But the best is when you discuss with other colleagues a new technology. So before something's launched, there are posters, there's abstracts, there are studies, and it's really, really important. And this is my pet peeve, that when you read a study or you hear about something new, you actually need a little bit of strength behind it, meaning how many patients are they testing it on? What are the safety protocols? What's your follow-up? How long have they been doing it? And you also want reputable companies behind that are doing the research, and a good advisory board. So there's so much that goes into when you just see something, say, on the internet. You got to make sure it's backed up by science behind it.
Right. No, of course. I love that.
Don't say of course.
No, of course, that's your protocol. Of course, that's what you do. That's what you say, because you're the best in your industry. So I would think that it's really important that stuff is peer reviewed and you have all these criteria. I mean, are there schlocky people? I guess there's D students in every industry, So are you aware of the people in your industry that are terrible?
Well, everybody has different strengths. That's a good way to say it. To be diplomatic. And some people are better at other things. And that's why it's important before you decide what to do or what to hear new technology. So just because something's new isn't better. And I'm going to pass the question back to you because it's kind of a difficult concept and then depending on where you are and your skin type and how old you are. So, you really want to be taken care of or work with patients who have similar thought process, who have similar likes, who have similar concerns. I think the biggest thing about the skin is when you look at it, you can see it. So it's right there. And sometimes it's scary for people. So you really want to find someone that you can talk to and understand, who kind of knows what's going on. And sometimes you get second opinions. And, we're so lucky because in this day and age, there's so much out there that you can use to build upon a knowledge base.
Right. Yeah, that's a very good point. But yeah, I guess people don't know if they're going to a bad doctor or a bad dermatologist. I mean, they have to find out the hard way.
Until their face falls off.
I know. You wake up one morning, you're like, is that my nose over there?
Yeah, but we're really good at picking up the noses and putting them right back. So I think one of the things with a lot of doctors' offices, medi spas, this topic comes up all the time, only because there's so many medi spas and there's, all of a sudden there's a storefront and you run in and you get your Star Wars laser zapping and it's bad. So don't do that. Make sure there's something reputable.
Now, we've had Botox for quite a while now. Decades and decades. Is there anything else?
Both us personally and as a collective.
No, I'm just saying, as a world, as a society.
And as a show.
We've had Botox for many, many years. Is there something coming years down the road that you've seen that is better or different or make wrinkles a thing of the past?
Wrinkles will never be a thing of the past because a lot of wrinkles come from smiling and laughing and eating and talking and using a straw, which I don't think people should do. But they're different. This is the cool part. So there's different muscles that we use in our face, and they all have different receptors. So Botox or neurotoxins work on the different receptors. Some receptors last longer than others when you block them. So there are so many different types of neuroblockers coming down the road that actually are going to last a little bit longer, which is nice because I don't mind sticking people less. But you have to remember that you don't want something to last forever because your face is going to change. Your muscles are going to change. You change. We're allowed to get older,
Right.
You just want to do it in a really nice way.
Right. Yeah. Older, but gently.
Yes, I like that word a lot.
Wait, I never heard this rule before. So no straws?
Okay, I spend so much time getting rid of wrinkles around lips. Every time someone uses a straw, you are just killing those collagen muscles right there around that mouth. So I'm kind of strict about it. Drink with a cup. Yeah, see, I was PC even before we knew that we shouldn't have plastic straws.
I know. Wait, so what else should we? Okay, obviously not smoking. So it's the same thing.
Yeah, we're not smoking.
Okay, no smoking, obviously. No straws, no. What else? No. What else should we not be doing?
You can kiss, no problem. But I don't like that pursing of the lips. And then you see, actually, in a lot of selfies on Instagram, people are pursing their lips or they're, puckering up there and holding it. And if you hold it and freeze it, you'll see those little wrinkle lines. Squinting, throw some sunglasses on. If you squint a lot, you're going to get those little lines by your eyes. Easy things that you can do to just make your skin super happy and not have repetitive motions.
Wait, so our grandmothers were right. If you make that face, it's going to stay like that?
Yeah.
Oh my God.
Hit on the back when you're making that face, it's going to stick. Wow, we never knew that.
It's kind of cool when you think about it. You see, our grandparents are always right.
Mm-hmm.
Yeah, I'm just wondering when we're going to be, I think it's going to be easier. Just cut off the top of our head, put our brain in a different body, and then go on.
I kind of like my head, my face, even though it's got
Now
a
you
little
can
wrinkle.
see now. Just walk down the street and pick somebody. I want that. And then
I know. I saw a very, very tall girl today. I was like, what's that life like?
Mm-hmm.
I couldn't tell you, but I'm sure she gets a little more pollution because and pollution actually affects your skin too. So, although nowadays we're all still being really good in our masks. Well, I'm in New York, so
right. Yeah, no, it's safe. It's safer down here. There was a new study that came out today. It wasn't really a study. It was just an article I thought was really interesting. It was in a Women's Health or Shape or one of those magazines. And they were saying that your dermatologist should look like you in terms of age, skin tone, all that kind of stuff, because they've had the same experiences, which I think is really bizarre. Because, that kind of says that doctors only know themselves, which is not, I could see if it's a different industry, but in dermatology, isn't skin? You know how to work with people of color. I know the skin's different, but why would they put out an article like that? I thought that was really interesting.
Okay. So I hated that. I read it and I was like, oh, give me a break. So, there's a lot of diversity issues and everything comes up, which I agree, but that wasn't the point. The point of it was saying that when you look at training programs for dermatology, I think you should train in a city, an urban setting, so you can learn about all the different types of patients, all the different types of skin. There actually are differences in skin. Darker skin tends to shed a little faster, and there's actually less ceramides in it. So you need to do a little bit different moisturization. But I don't think you need to look like your patients. I actually think everybody should look like themselves. But the idea of the model skin, when it should be perfect, is not. Everybody's skin is different. And that's actually what I love about dermatology, is because, yes, you do know some skin needs more ceramides, but that's everybody. Old skin and young skin, one of my favorite parts is taking care of families, because I get to look at the genetics of different generations. And for example, today I saw someone, and I take care of her mother. Her mother's got a lot of wrinkles around her eyes. So I'm like, you know what? We're going to attack these a little bit earlier. That way I know how you're going to age.
Right.
But, we're lucky that I think it's more if you can find someone that you can talk to and that they understand what really concerns you. And I do like all ages. I think it's fascinating, and I learn from my patients every day. So
I like that you said it's important to be in a city, because I always thought that, like, in terms of my veterinarian, I found that a veterinarian in New York City, just like a dermatologist, you see a lot of people, you see a real diverse population, you see things on a daily basis that like a country doctor might see once a year. So something that you'd recognize in a second, like, is this skin cancer? Yeah, that's skin cancer. As opposed to as opposed to a doctor who, sees like 5 patients every 6 months is probably like, I think it's skin cancer. I don't know. Let me check, whereas you can recognize stuff immediately because you see it all the time.
So it was kind of interesting today because I had someone come in and they had kind of a weird rash. Like, it was a bizarre, it was like a swirly thing. And I'm looking at it and I'm like, this is super weird. What makes swirls? And then you stop and I go, wait a second. Were you practicing your Halloween makeup this weekend? And then the patient goes, oh my God, yeah, I did use a henna tattoo. And I'm like, okay, here we go. This is what your problem is today. So it's just, you just got to always think outside the box. And if you don't do that, you're kind of missing the boat with your patients. So, and then, a lot of times people, they have a spot. I think the biggest thing that people have is they have a spot, pops up, there's family history of a little bit of skin cancer, and you are worried and you're scared. So you know what? Just come in, you take a look, and we take care of it. That's like the best part. I tell people when they're at home to take a good look at their skin. And if they see anything that looks new or pops up or bleeds, just make an appointment with your doctor. Why worry? Just get it checked out. And this is probably the best thing that I love when I see my patients is I tell them when they go home that night, get naked, look in front of the mirror, look at everything, because I've checked you and you're good. So you kind of get to get in touch with your own skin when you know that it's a good starting point.
How often do we need to go to our doctor to have them check everywhere?
I like once a year. If you have a lot of history of skin cancer or you've been in the sun, a lot of my swimmers, my surfers, even in the city, they've gotten a little more sun exposure. So for those people, I'm like 6 months. There's some family histories where you have hundreds of moles. Those people, it's different. You need to be checked every 3 to 6 months. It all varies depending on a person's skin type. So for the average person, kind of once a year is a good thing.
Are you finding that you're seeing different skin things, either less or more after COVID? Because I feel like people spend a lot of time inside rather than outside in the sun. They didn't travel as much. So do people have less skin cancer, but more other things because they're home and there was other issues going on? Like, how did the pandemic affect our skin?
Oh, Cooper, oh my gosh, 2 different things happened. One is not so good. One is that people didn't go out, so they stayed in. So skin cancers that people had that were smaller, that kind of should have been treated or picked up or caught early, they grew. Okay, so that's kind of the bad part. But the minute, we opened up, people ran into the offices. So there was a little bit of a backlog to catch cancers. And the whole idea is you see something early, you take care of it. So we're coming out of the backlog, which is really good. The other thing is that when people were outside, nobody put their sunblock on as much as I would have liked them to. So people tend to burn a little bit more. So a little more freckles. I've been lasering, I've been zapping, we've been chemical peeling, we've been vitamin C topical. I mean, you name it, to try and help people. But you know what? Everyone needed a break. You needed to go outside and you needed to have fun. But when we all put our masks on, those areas, especially like the nose and around the mouth, were protected from UV exposure. So I'm like, yeah, there's always a flip side. You got to look at the bright side.
Well, not in the South because people only wear their mask here. So the North still gets it.
Oh my God. Can you imagine the weird tan lines that people have?
Yeah, it's that. They're sleeveless and they're like noseless. So it's just it's like a tan on your nose and it's so weird down there in the South where Anthony is.
Anthony, one of the problems I saw actually also is a lot of people burned on the sides of their jaw and the side of their neck. So I've been seeing a lot more precancers actually along people's necks these days.
It's a lot of red
that
necks.
area just wasn't covered. Yeah.
So the necks are red.
The necks.
Red necks. Okay.
Red necks. It comes from
literally
exposure. Literally.
Red necks.
Like you gotta throw some freckles in there too.
So how do you handle patients that are hypochondriacs? Because I find that no, I'm really serious about this because I think all doctors experience this where people come in and they insist they have something. You know, I've dated many hypochondriacs. I've been hypochondriac.
Shut up. That is so you.
No, well,
you dated hypochondriacs. Look in the mirror.
Listen, I know I'm bad, but trust me, I was with somebody who was way worse.
That's impossible, but okay.
No, I'm telling you, like way worse than me. But I always think about from a doctor's perspective, people that come in that are total hypochondriacs, like how do you handle it? What percentage of people are actually like that?
So it's a little bit skewed because if you're a hypochondriac, you're actually going to go to the doctor and you're going to check it out. So I can't give you an accurate percentage.
Okay.
However, you know what? You just have to reassure, and also education. Skin education is amazing. So if you know, okay, I'm scared I'm going to get a melanoma. Well, melanomas are kind of hard because they can look like lots of different things. But basal cells and squamous cells or precancers, I try and teach people. So when a hypochondriac comes in, I go, okay, show me what's bothering you. And then I try to show them other things on their skin that look like that are totally fine. So it's just, you want to reinforce the good. The internet is evil when you look at really nasty pictures of skin, because everybody's skin looks like something really bad on the internet, especially with those photos. So I really, really, really try super hard just to reassure them and keep them calm. However, can I tell you, hypochondriacs, they find things. They find early precancers. They find a tick on their skin.
Right.
They do really good sun protection. So
that's a good point. Right.
Yeah. I actually.
They're super careful.
They are.
And they come in. You come in all the time. Yeah.
Now, what about? Do you have? What's the weirdest skin thing you've ever seen? You ever get challenged? Like somebody comes in with something, you're like, what is that even?
Like alien abduction. Have you seen that?
I haven't seen the alien abduction recently. I probably have seen an alien and just didn't know about it. I'll give you that one.
Nice.
But you know what? I get stumped every day, and actually we should get stumped every day, because if you're not really thinking. So I'm trying to think of the weirdest. I mean, this swirly tattoo thing was like, I did think it was like an alien imprint, but it wasn't. It was like a tattoo. Itchy skin. You know what? Okay, this has happened today. Someone pointed to a spot on their skin. I saw nothing. I saw absolutely nothing. Now, you can have nerve pain and nerve itch. And on that skin, it shows absolutely nothing. So I go to the patient, and she keeps pointing to this spot. I said, I'm sorry, I just don't see anything. I magnify or angle the light different ways, everything. Still nothing. But when someone complains of nerve pain, then it makes you think, okay, where's this nerve coming from? And then I'm like, how's your shoulder? Because the pain was on her back. And she's like, how did you know?
Wow.
And so, you have to tie things together. So actually, that was my weird thing of the day. I had the tiniest little melanoma. I had a lot of brides today. Brides get so nervous. So we had a lot of acne along that jawline. Halloween allergy is like, I'm sure, oh my God, the chocolate. Everybody's eating their chocolate early here these days.
Yeah, why wait?
I agree. And the weirdest thing I probably have had is a black spot. And this was like the beginning of last week. Someone had a black spot on their back. They sure it was cancer. And it was a moving tick. Yeah. And I was like, when I saw the little legs, I was like, I took a step back just for a minute. But, ticks, their mouths bite really hard and attach to the skin, and they are not coming off. And then when I'm sorry, it sounds gross, but when they drink the blood of the person that they're stuck to, they get bigger. So you see this black thing and you're like, oh no, this is bad cancer. What is it? And then you look and see legs and you're like, oh good, it's a tick.
How do you get that out right? I know how we used to do it back in the day, but how are you supposed to get the ticks out?
Got to get the mouth out, because the mouth has probably carrying some of the Lyme virus or Borrelia or ehrlichiosis. There's lots of different issues with Lyme. So you got to take tweezers and you got to go right to the mouth, and you got to go underneath and you got to lift it out. I saw someone took like a toothpick and they twist around a string and they pull it off. But if you don't get that mouth out, and you can just really, really, really pull hard. Some people will put like a little bit of Aquaphor on to loosen it. Aquaphor is like a Vaseline. Okay. And I find that helps a lot as well. The important thing is, if you think that tick's been on for more than 24, 48 hours, then you really need to be treated with a little doxycycline. Or when I take a tick off, if I find it, I'll send it out and have them check for different organisms to be on the safe side.
Where'd the person get the tick
to come back?
Wait. Where'd the person get the tick?
They were hiking. They were hiking this weekend.
Okay, not in New York though, right?
No, not in New
that's
York.
all.
Yeah,
like not at Fairway. I just want to make sure, make sure I'm safe.
How long
could have been Times Square? You never know these days. We've got a lot of visitors there.
Does that test come back pretty quick, or do you have to wait a day or so?
So I think I give them emergency doxycycline. It's like, you remember what was it, step B, plan B, when the condom broke or something?
Yeah.
So you give them a pill. So with Lyme disease, you kind of do the same thing with an antibiotic while you're waiting to get the result. But we actually do have some ticks in Central Park here.
Okay,
so you have
avoid
to be
Central
careful.
Park, making a note of that.
Hypochondriacs, make sure you're wearing your clothes when you're in Central Park.
Oh yeah, I'm going to be head to toe. I'm going to be like, I don't know if you've seen Kanye lately, but he's wearing like this, like a hoodie backwards where his whole face is covered. And he's like head to toe. You can't even see his fingers, gloves, the whole thing. That's going to be me.
We want to see your face. You don't have to be like that.
No, it's actually perfect because no melanoma, no ticks. I mean, I don't see any reason, why I ever have to go out with anything less than a burqa ever again. I'm just saying. I think
How
it's
about
a good
big hat. Let's throw a big hat on.
I'll do a big hat. Okay, fine. At least that's
and very sexy sunglasses to cover the eyes.
So give us one thing that's going on in your industry right now that we wouldn't know about, that is like the next thing or fascinating or something you're working on. Like you're so up on the dermatology industry. There's got to be something coming down the pike that you are excited about that we don't know about yet.
So we're looking at different ways to tighten the skin. So one of the issues with everyone on Zoom this past year is that people's jawlines and their jowls and their necks are kind of sagging a little more. And there's that tech neck where you have the wrinkles on the neck. So a huge focus is, how can we get people's necks a little bit better? So there are different combinations of technologies, different radio frequencies, different ultrasound. We have a new machine called SoftWave. It's similar to Althera. So what you want to do is you want to stimulate these things called heat shock proteins in the skin, which will then tighten your collagen and lift up. There's a big surgery boom. And a lot of people are doing their surgeries to do their neck lifts, but let's try and find non-invasive ways to get that skin to tighten. There's something called an E-core machine where you take out tiny little 2 millimeter little pieces of the skin to try and get it to tighten. Sometimes a small cut heals and the skin contracts a little bit. So there's lots of research looking at different ways to make that better as well. But these days, sometimes new is not always better and old is pretty amazing.
Right.
So we've been doing Oh my gosh, everybody's so happy. We've been doing so many aqua golds here in the office. I'll explain what that is. So it's a little vessel. You take a little vial, you add a magic potion to it. It's got some neurotoxins, which is kind of like Botox. You put a little hyaluronic acid, which is like a filler, but it's like a skin booster. And then you put some exosomes and you put some vitamins in it and you run it all over the skin with little micro needles. And if I sound excited, I am, because you don't have to worry about skin color. You don't have to worry about sun exposure. Everyone looks awesome and great for weeks after. So it's like, I don't know if you guys are seeing this, but everyone seems to be getting married right now, or everybody's going out. Everybody's doing so many things. You gotta look like better yesterday. So everybody, to make everyone glow and just feel good. And the best part, it's for all different skin types and all different ages. So I have like the mother of the bride. I have the bride. I have the sister-in-law. Like, it's just.
And they're all doing this procedure.
Well, yeah, but I mean, you tailor it a little depending on in the vial, in the potion, what it is that you are aiming at. So we have so many things in our medicine cabinet that when you combine them together in different ways, you get such synergy and more of an oomph and a boost. So if you ask me what is hot and new, basically it's combining things in a little more sophisticated way.
I love that. That's cool. I'm going to look. Should I look into that? I think I should look into that.
I think you should go do that now.
Well, we discussed doing micro needling.
Yes. But now, I changed my mind on this. So now we still do, no, we still do microneedling, but I want a little different potion to go on your skin with the microneedling, because the combination of the pollution and a little stress, and people are going out a little more, and a little more alcohol and a little more life and less sleep. Everybody needs a little more of a boost. I think we were all on a nice pause, and now we're all moving, but we're moving a little too fast again.
Right.
So this is actually a way to get your skin to kind of catch up with where the rest of you is.
I love it. That's great. Dr. Diane Madfes, thank you so much once again. We will go to your website, which is, let me get it because I didn't have it up. I'm so terrible like that. Okay, hang on one second. I had it and then
You'll pull it back up.
Madfes Aesthetic Medical Center.
That's us.
Yeah, DianeMadfes.com for more information. And now you have offices in Connecticut as well. So you're in Connecticut and New York. And
And I think we may be adding Florida for a little bit, because everyone's kind of on the move all over the place. I'm trying to make life easy for the patients. So
nice.
Stay tuned.
I love it. Well, thank you so much for this amazing information. And we love having you on. Thank you so much for answering our stupid questions.
Nothing stupid, and have an amazing rest of the day.
Thank you.
Thank you so much.
Right.